Now, with Breast Cancer Awareness Month comes a lot of myths and misconceptions, so here to help distinguish between fact and fiction is Dr. Thomas Harris, medical oncologist at Texas Oncology. Thank you so much for joining us.
Thank you for having me.
Now, let's just delve into some of these myths that you have heard.
Well, this is Breast Cancer Awareness Month, and as an oncologist at Texas Oncology, we do hear some of the myths with breast cancer. Some of the ones that we'd hear is that if I don't have a family history of breast cancer, then I can't get breast cancer. And actually, breast cancer can affect about 1 in 10 women. So my recommendation is to get screened. Really want to encourage women to get screened. It's so important to do so.
And about what age are we talking to get screened?
The age can vary depending on a patient's risk profile. So I would encourage women here in Waco to discuss that with their primary doctors. But generally 40 is considered a range for women with limited risk factors.
So this affects so many women, but it also affects men. So what are some myths that you've heard with men when it comes to breast cancer?
It can affect men. It is uncommon, but can. As an example, there are some families that are of higher risk and men can develop breast cancer. If a male were to feel an abnormality in their chest wall, I would encourage them to seek care with their primary doctor and get that worked up.
Doctor, are there some treatment-specific myths that you've heard?
Yes. Part of getting the workup for breast cancer, sometimes we'll hear that if you get a biopsy or have surgery, that the air can spread the cancer, or that the surgery itself could spread the cancer. And that's just not true. The biopsy and the surgeries can be life-saving, can help detect the cancer and then treat the cancer. So those are very important modalities. And the good news is that there is lots of new research coming out with breast cancer and new treatments for men and women.
Good to know we've come so far. Really quickly, what about mammograms versus, what would be your truth for that to combat some fiction?
Mammograms save lives. Getting screened with mammograms will save lives. And it's so important to do so. There are some myths of worry about whether mammograms are effective or whether mammograms can cause damage themselves. But there have been extensively studies, and by getting early detection and early screening through the use of a mammogram, lives can be saved.
Thank you so much, Doctor.
Thank you for having me.
Thanks for joining us.